Hello and thank you for taking the time to watch this video. We are occupational therapists working in the core Paediatric Occupational Therapy Service in the Southern Trust. Your child has been referred to our service and is currently on the waiting list.
The purpose of this video is to provide an overview of what the Paediatric Occupational Therapy Service is and how our service may be able to help your child. This should enable you to make an informed decision about whether your child still requires our input.
Occupational therapy is defined as a client-centred health profession concerned with promoting health and well-being through occupation. The primary goal of occupational therapy is to enable people to participate in activities of everyday life. In the context of paediatrics, occupation refers to children's need to play, learn, and participate in self-care.
Core Paediatric Occupational Therapists assess school-aged children in the areas of fine motor skills, gross motor skills, handwriting, perceptual skills, self-care, and sensory processing.
Your child has been referred to occupational therapy because they have difficulty in one or more of the previously mentioned areas, which impact significantly on their level of functioning. With that said, it is important to remember that each child develops at their own pace and to acknowledge that children with learning difficulties will develop their motor skills at a slower pace.
Fine motor skills refers to the small muscle movements of the fingers and hands needed to grasp and manipulate objects. For example, cutting with scissors, building Lego, or threading beads. If a child has difficulty with fine motor skills, you may notice that they frequently drop objects, have difficulty with two-handed activities, and present with reduced stamina or motivation for fine motor activities.
Gross motor skills refer to your child's ability to use large muscles of the body in a controlled and coordinated way. For example, to run, climb, use a bike, or play with a ball. If a child has difficulty with gross motor skills, you may notice that they appear uncoordinated when running in comparison to their peers, have difficulty participating in group sports, or they may fall more frequently than their peers.
Handwriting is a complex skill which incorporates visual perception, visual motor integration, eye-hand coordination, good posture, and fine motor coordination. If a child has difficulty with handwriting skills, you may notice that they hold their pencil in an unusual grasp which impacts on the efficiency for handwriting tasks, have difficulty with legibility of handwriting, and for older children, paediatric occupational therapists can have a very important part to play in helping schools understand the impact of handwriting difficulty on the child's ability to access the curriculum and fully partake in the time-limited examinations.
Perceptual skills refer to the brain's ability to make sense of what the eyes see. It is essential for tasks such as reading, writing, drawing, and completing puzzles. If a child has difficulty with perceptual skills, you may notice that they avoid tasks such as jigsaws, puzzles, dot-to-dots, struggle to find objects in a busy environment, for example, a household item in a busy drawer, or have difficulty with visual memory games.
Self-care refers to essential everyday tasks that a child must complete, such as feeding, toileting, dressing, and washing. If a child has difficulty with self-care skills, you may notice that they have difficulty coordinating their cutlery, need more support than peers or siblings to get dressed in the morning, and rely on peers or become anxious when eating lunch or getting changed for PE within school.
Sensory processing refers to the organisation of sensory information from our own body and the environment, which allows us to function efficiently. It involves processing visual, auditory, taste, smell, tactile, movement, and proprioceptive input. Proprioceptive input refers to the messages our muscles and joints send to the brain to acknowledge body position in space. For example, if your eyes are closed, you can still tell that your arms are by your side or your feet are on the ground. It is important to remember that everyone has preferences to certain sensory stimuli. For example, Some children need more touch input and are often seen to be fidgeting, whilst others are sensitive to touch and certain textures. Some children need more movement input and are described as not being able to sit still, whilst others are more cautious of movement and are seen to avoid movement activities. Some children have difficulty with proprioceptive input and have difficulty judging force of their movements. They may throw the ball with too little force or grip their pencil loosely, whilst others throw the ball with too much force and grip their pencil tightly. However, it is important to remember we all have sensory preferences, and it is only when they impact on the child's ability to complete daily tasks that an occupational therapy assessment and support regarding sensory processing is required.
In terms of our service provision, our service is continually developing and aims to meet the needs of the children and families we work with. Dependent on the individual needs of your child, our provision can include advice for parents, sensory motor groups within schools, DCD pathway, individual or group-based support. We will discuss sensory motor groups and the DCD pathway in more detail.
Sensory motor groups are running in lots of schools throughout the Southern Trust. The core Paediatric Occupational Therapy Service have developed these groups and provided training to school staff on how to run them. They consist of a circuit of activities that develop sensory and motor skills and are an excellent way for children to develop their skills. This may be something your child could benefit from if it is available in your child's school. We are continually providing this training to schools at their request.
Paediatric occupational therapists are involved in the diagnostic process for children with potential developmental coordination disorder, also known as DCD. DCD is a condition which impacts on motor skill development, and it is diagnosed when the delay in motor skills and inability to coordinate movements results in a child being unable to perform common everyday tasks. These difficulties cannot be explained by neurological condition or learning difficulties.
If your child has motor coordination difficulties associated with developmental coordination disorder, separate assessments will be completed by a paediatrician and an occupational therapist. Some children may have been referred to core occupational therapy by a paediatrician. For those children who are not known to a paediatrician, the occupational therapist will make an onward referral when considering a DCD diagnosis. Information gathered during the assessment process will then be combined to reach a decision about the diagnosis.
Parents and carers have an active role. Whatever the service provision you receive from occupational therapy, it is essential that you enter into the process with the view of working in partnership with the occupational therapy staff to benefit your child. Consistent practice of home activities is the most important part of the process and necessary for achieving long-term positive outcomes.
We would also like to take this opportunity to inform you regarding the RISE NI service, which is available to all mainstream primary schools within the Southern Trust. It is an early intervention service for children aged between 3 and 8 years and includes occupational therapists, physiotherapists, speech and language therapists and behaviour therapists. Staff deliver specific training and whole class programs in a number of areas. If your child's needs are predominantly within the school environment, then please discuss with your child's teacher or special education needs coordinator regarding a possible referral to the RISE team. They only accept referrals through school. Even if your child is on our waiting list, they can still access RISE input.
Thank you so much for taking the time to watch this short video. We hope it's been helpful and informative.
In accordance with the letter you have received, please notify us if your child still requires our service at this time. Thank you.